Join us this evening as we host one of our viewers' favorite shows, Ask Anything. Tonight's show focuses on all medical topics affecting those in our viewing audience. Ask Anything tonight on Call with the Prairie Doc. Major funding for On Call with the Prairie Doc has been provided by
At Avera, our nationally recognized health system will be right here with you, with care and coverage. Hello possibility. Hello healthy. Hello life. Avera, moving health forward.
Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information. And with the ongoing support of these individuals and institutions, Brookings Health System, South Dakota Academy of Family Physicians, Sanford Health, Avera Medical Group Brookings, Avera Heart Hospital, First Bank and Trust, Dakota Allergy and Asthma, Monument Health.
Lions Clubs.
Good evening and welcome to On Call with the Prairie Doc. I'm Dr. Jill Kruse, your Prairie Doc for this evening's program. Tonight we begin our 24th season providing health information based on science, built on trust. Tonight's show is one of our viewers' favorite shows, Ask Anything, where we answer any question about any medical topic. In the studio this evening are our three other Prairie Doc guest hosts, Dr. Kelly Evans-Hullinger, Dr. Debra Johnston, and Dr. Andrew Ellsworth, all from Avera Medical Group here in Brookings. Thank you all for taking time to kick off our new season. For those new to the show, let's start with some introductions. Dr. Ellsworth, what's your background in practice?
I'm a family doc, so I've been in Brookings, and I see all ages, and I have a variety in my practice. I see babies and go to the nursing home too, and I love taking care of whole families, multiple generations. It gives me more variety, and it gives me more ability to see the whole picture and take care of the whole family, and that adds a lot of meaning to my day.
Excellent. Well, Dr. Evans, what about your background in practice?
So I'm from Brookings and ended up back here. I wouldn't have believed that when I was a teenager, but here I am. I've been practicing back here for 9 years. I do general internal medicine, so I do primary care for adults and a lot of elderly adults. And yeah, I love my day-to-day, do a lot of teaching of medical students, and have really enjoyed being back in my hometown.
All right. And Dr. Johnston? He needs no introduction, but we'll give you one anyway.
So I also am a family doctor, just like Dr. Ellsworth, but I've been in Brookings probably longer than all the rest of you together. Since I finished my residency here, I came to Brookings in '96 and have been here ever since. And I have patients that I have taken care of that whole time. And that is really a wonderful feeling to have kind of grown old with my patients. So, and you know, some of those babies that I delivered early on now are bringing their toddlers to me, and that's really a fun thing.
Young at heart.
Young at heart, yes. Well, in some way anyway.
Right. Wonderful.
And Jill, your background. You didn't think I was going to let you escape that, did you?
Darn. Yes. So, well, this is my 12th year now here in Brookings, my 20th year in practice. So I was in Wisconsin for residency and then came here to Tyndall, South Dakota for 5 years, did rural family medicine, and then moved here 12 years ago. And I've done lots of different things. So I've been in clinic with all of you, and then COVID hit and I started doing more hospital work, and then transitioned to full-time hospitalist at the Brookings Health System when a position opened up. And then this past year I opened my own clinic where I'm doing FAA flight physicals. So I've kind of dabbled into lots of different areas of medicine, but definitely keeping it interesting.
There you go.
All right. Well, before we jump into our discussion, I'd like to take a moment to express our gratitude to all our viewers. As volunteer Prairie Docs, your contributions each week are invaluable. Each dollar you give helps us produce meaningful content that empowers individuals to make informed health decisions. Donations can be made directly to the Prairie Doc online. Now, let's turn our focus to you, our audience. We invite you to submit your questions for tonight's conversation as we answer all medical questions and topics submitted. There are 3 ways to reach us. Call 1-888-376-6225, send an email to ask@prairiedoc.org, or engage with us through Messenger or on our Prairie Doc Facebook page. We do our best to address as many of your questions as time allows. If we can't get to yours, we sincerely apologize. All your questions are anonymous and no information will be saved. However, if you would like to leave your name, email, or a phone number, you'll be entered into a drawing for our Prairie Doc publication, Perspectives from the Prairie. It's not a requirement to submit a question. We'll announce the winner at the end of the program. Well, lots of your questions.
I actually like to call this show Stump the Prairie Doc. This particular show, when it's the 4 of us, and usually people manage to do that at least once or twice. So, that's the wonderful thing about primary care. We have a very broad knowledge base, and between the 4 of us, we can make a pretty educated guess at most things.
We're used to people asking random questions all day long.
All
so
day
it's
long,
okay.
yep. And we're used to saying, I don't know, but here's how we can try to find the answer.
Yep.
That's an important part of primary care.
Well, let's dive in because
Yes.
we have a couple of questions that have already been coming in over the summer, so we're starting out.
Let's do it.
So an email came in and it says, I keep getting a ringing in my ears. Is that a sign of something serious or is it just stress? It comes and goes during the day.
That is such a common problem. Tinnitus is such a common problem. There are some situations where tinnitus can be a sign of an issue, particularly something we call pulsatile tinnitus, which is almost hearing your pulse in your ear there. That can be a sign of abnormal vasculatures, an ear issue. It can be a sign of some issues. But most of the time, tinnitus is actually a sign of hearing loss. So it is an extremely common problem, and it can be very, very annoying to people, and a lot of times hearing aids can be extremely helpful.
Yes, because they kind of do that noise cancellation where it can kind of match that frequency and cancel it out.
Anything to add, guys?
Yeah, your brain is just not hearing as much, and so it starts to make up things that it's hearing, and your brain is actually making up this noise, and that's why sometimes you notice it more at times than others, or at night, or when things are more quiet, or whatever. And so, yeah, background noise can help. Hearing aids can help, but it's good to get evaluated, good to get tested, and if you do have hearing loss, it is helpful for your whole body and your mind to get hearing aids and to wear hearing aids, which helps you engage with others and connect with others, and then that can help decrease your risk of depression or even dementia by staying interactive with the world around you rather than just kind of closing off and getting shut down or your world getting smaller. So it is something that worthwhile looking into.
Excellent. Well, let's keep going because we've got more. So a viewer says, my big toe has been numb for a few days. I have diabetes, but my levels are okay. Is this something I should have looked at or wait another week? Dr. Evans, what would you say?
I think I would advise my patient to probably watchful waiting is okay for this problem. Diabetic neuropathy, which is one of the most common reasons we see numbness, tingling in the toes or feet, much more commonly will be a little more widespread than a single toe. I think if someone comes in with a single toe of numbness, that's probably more likely like a nerve compression, a small nerve compression type of thing. It may get better, but I think there's probably not a huge huge urgency with just if the numbness is the only symptom, to give it a few days, or give it some time before you get it checked out. Now, I mean, reasons that are more urgent that might affect just a toe would be if you're getting more pain, or if it's changing color on you, or it feels cold compared to your other toes. That might be a sign of something different than just a nerve impingement. But
pay attention to your shoes.
Yes.
You know, if you've got a new pair of shoes, especially if you're female and have decided to try those the beautiful stiletto heels,
it might just be getting squeezed.
you might, maybe wear some tennis shoes for a little while. And if it's numb, also you be sure to look at your toe and make sure there's no sores developing on it.
I have had patients that stepped on glass and didn't realize it, and now that glass is festering and can cause an infection that they didn't realize until days to weeks later.
Until it was really advanced and really a problem.
I might add that diabetic neuropathy often affects both sides. But it can be one toe, but both big toes. The big toes often seem to go first, and it might be something they don't notice. It's just, when we're testing just a little bit, it might be a little decreased sensation on the big toes, but we want to keep the diabetes under control so it doesn't get worse, where now they're getting more pain.
Backs also, back problems can also cause numbness in the feet. So.
Excellent. So lots of different
possibilities, but probably not something you need to run into the clinic
an
for.
emergency type of problem.
All right. Well, next question. My 74-year-old husband has started falling out of bed. This never happened until a few years ago. This happens a few times a year now. He's always been clumsy. I've asked his doctor and was told that he's always been clumsy and nothing's changed. He never gets hurt other than one time bumping his head or hurting his elbow, nothing serious. They don't know what to do.
I have more questions about this, actually. One thing that comes to mind that I see in patients in this age group on occasion is something, I wonder about REM sleep disorder. So this is a sleep disorder. It often goes along with Parkinson's disease. I don't know if that's true of this patient or not. And this may or may not be it. But what happens in that disorder is that patients, when we're in REM sleep, so deep sleep where you dream, our bodies should kind of be paralyzed. And in this disorder, it's not. And so people tend to act out their dreams. They might yell, they might thrash around, they might do something with their bodies. And so sometimes that leads to some of these sleep-related injuries. So I'm curious about if there have been any behaviors that the spouse has noted about this. And maybe I'm totally off base. Maybe it has nothing to do with a sleepover or sleep disorder, but just clumsiness, in which case it's probably practical solutions. Maybe the bed needs to be slid up against the wall. Maybe you need to get a lower bed so that to reduce your risk of injury or something like that.
As we get older, men, you might be going to the bathroom more often at night because of an enlarging prostate. And thus, lately now he's maybe going to the bathroom more at night. And then what can cause us to fall? Well, when we've been laying down all night and we suddenly get up, we can get lightheaded more easily, which also can happen more easily as we get older too. So then a person has to give themselves more time to adjust. And so that could be a factor. Or maybe we need to turn on the lights. It's not great for your partner that's still trying to sleep, but you're less risk of fall if you can see better. Or maybe you need your eyes checked, or maybe cataracts, or the list go on and on of possibilities. So that it's worth a talk. Now, if you go to the doctor and say he's always been this way, the doctor is maybe more likely to say, sounds like he's always been this way. But so present it as this is a problem, and what can we do to help, and maybe they can get more help.
Yeah, I always say, I'm concerned about this. This is a change. This is affecting my quality of life or his quality of life, and I'm concerned about an injury.
I think we're all more concerned about things that are different, that are changing, and that was kind of my first thought too, is that maybe this is someone who would benefit from seeing a neurologist. But your point about those more practical things and more common things is a really good one. Yeah. So and that's more information. Is he awake, or is he asleep and ending up on the floor?
Right.
Any history of sleepwalking as a child? What is that history?
The other point is this is a concern. It might be worth its own visit. Yes. It can be so hard to address when there's
when you're
10 other things, or it's the annual wellness visit or
Mm-hmm.
something, and maybe this deserves its own visit so it can have a really thorough assessment.
Yes.
Yes, this definitely would deserve its own visit.
yeah.
Please don't throw this one on top of
Yeah.
6 other things.
All right. Another viewer says, I've been feeling unusually tired and cold all the time, even when it's warm. What could be causing this? Oh, there's a big differential with this one. A lot of things. I would say, oh, let's check and see what your hemoglobin is. Are you anemic? Let's check your thyroid, see if that's, are you, what age? Is this a hormonal issue with perimenopause or menopause issues? There's lots of questions. What medications are you on? Yeah.
Yeah, once again, the list goes on, and it deserves a visit to talk and some lab work, like you said. So, yeah, but worth looking into, absolutely.
Definitely. All right. Another viewer says, I'm in my 40s and my hair is thinning a lot lately. Is this just a sign of aging, or it could be a symptom of a vitamin deficiency? I know I'm in perimenopause as well. We have a menopause show coming up this season. Watch it.
Yeah, there's one in the archives from last season.
And there's one in the archives from last season. So yes, while you're waiting for that show to come up, pull back the archives.
Yeah.
Yeah.
I feel like I've had this conversation this week, honestly, with a patient. I think most commonly when patients come in concerned about hair thinning, it probably is aging. Certainly perimenopause and menopause can change the textures, some qualities of your hair, absolutely. And then aging alone in other populations can cause age-related hair thinning. If it seems out of proportion to what you would expect, it's certainly okay to go talk to your primary care physician about it. I mean, there's certainly abnormal things that can cause hair loss too. Thyroid disorder, again, is on that list.
Anemia.
And some dermatologic disorders. You know, we should look at the scalp and we should kind of see if there's any actually really bald spots. Like I say, most commonly, it's not one of those more medical causes, but sometimes it is. So, yeah.
Weight loss.
Yeah.
You know, that's one of the things that we see a lot with people on those weight loss shots, losing hair.
A traumatic event or childbirth or whatever can, you know, your telomeres reset, and then now you lose a bunch of hair at once 3 months later, and again 3 months later, or whatever.
Yep.
So.
I always tell people, what happened 3 months ago?
Yeah.
And then we start dialing back. Were you really sick? Was there a stressful event? You know, what was going on at that time? Because that can definitely affect those hair follicles, and then they all shed at once and are more than normal. So yes, all very good questions, and you know, something definitely to bring up with your doctor. So. Well, since 1964, the South Dakota Lions Foundation has provided programs that serve the visually and hearing impaired. Jennifer Seghetti, the executive director of the South Dakota Lions Foundation, spoke with Prairie Doc about how they are supporting the youth and adults in our state and beyond.
Lions clubs have been around for over 100 years. Helen Keller herself asked Lions to be Knights to the Blind. And in South Dakota right now we have over 71 Lions clubs in almost every community across the state.
Seghetti says each club does work for their community, but their overall mission is vision.
30 years ago, we recognized that South Dakota didn't have an eye bank, and so we helped form the Lions Eye Bank, which is now its own separate organization.
She says the foundation has programs including eyeglass donation and a Kids Sight Vision Screening Program.
We use these cameras. It's a well-challenged spot screener. This is about a $8,000 to $10,000 camera, and all we do is take a simple picture of the child's eyes. Within a second, our screen tells us if they need to see a doctor for a complete eye exam. We're hoping to start reaching out to the general public and explaining this. Our Kids Sight Vision Screening Program isn't just for Lions. It is for the 120,000 kids in the state that need to be able to see so they can read. There are great opportunities to volunteer, and you do not need to be a Lions Club member, especially with our Kids Sight Vision Screening Program. We can train you how to use the machine in 15 minutes. If you're familiar with your smartphone technology, we can train you, especially if you like working with kids.
Seghetti says the Lions Club is by far the largest service organization in South Dakota.
Vision screening in kids is just so important. I go back to, if you haven't learned to read well by 3rd grade, After 3rd grade, kids are reading to learn. And so if they're not going to be able to read to learn things as well as the kids who have mastered reading by 3rd grade. And the number one thing of teaching kids to read is their vision, is their sight. And so if they're looking up at that whiteboard and the teacher's explaining even the basics of the alphabet and they're not able to see that, we are putting those kids at such a disadvantage.
What a wonderful organization. What other organizations have you guys worked with that deal with various health issues in the state?
You know, I think that there's an organization at some level, some size, for pretty much anything you could look for. I think a lot of the local hospitals, I know our local hospital does a lot of support groups and educational things, and you know, Birth to 3 is a program we use a lot. 60s Plus Dining is another wonderful organization at the other end of the spectrum. It's kind of a boy, when I have somebody who needs something, I ask our care coordinator, and it's amazing what she finds.
Yeah, I used a lot of the Alzheimer's Association and the Parkinson's Association. So, you know, they offer support groups that are local and a lot of educational resources. So I direct families there a lot.
I'm thinking of Advance that help work with our patients with disabilities, or Lifescape out of Sioux Falls that work with all different ages of people with disabilities that need really serious care and that provide some great services.
Yeah, great. All right. Well, we'll go back to questions since I know there's lots more. Patient says, I'm a 50-year-old woman from Mitchell. I've been having trouble sleeping and feel anxious all the time. I've been cutting back on the news because I feel worse when I watch it. Yes.
Oh, just captured the moment, didn't you? I feel the same way. I struggle with this this balance between trying to be an educated citizen, but in how news is today, it's so overwhelming because you get it too constantly, you know. Whereas 20 years ago, maybe once a day you'd see it on television at most, right? And now we can really consume more than probably our brains are equipped to handle. So good job identifying something that stresses you and trying to cut back on that. Sleep certainly is affected by anxiety. I mean, that's probably one of the more common reasons that people have insomnia, is just some sort of anxiety or stress related disorder. And so honestly, the most effective solution is actually cognitive behavioral therapy, so actually doing a special type of sort of therapy as opposed to any medication to help you sleep in the long run. And some of that may help you get to the root of what is the source of these ruminating thoughts that keep me from sleeping at night. But yeah, I think you gotta take care of yourself a little bit. I've heard about people who say, well, I still want to be educated about the news, but I'm only gonna let my news app be on 2 days a week or something. I think there's creative ways to try and tackle that problem, but
avoid it close to bedtime.
Yeah.
You know, if you're, I mean, I've got to be tuned more in than I probably should be, but I try to not open that app, and I only do the app. I don't go to TikTok, I don't go to all of those other kinds of things. I will read my Apple News feed, and I don't always read the article, just a little bit of it, the first little bit of it. But you know, the cognitive behavioral therapy is absolutely the important thing, those sleep rules, all of those things for insomnia. But, you know, some people do need therapy for their anxiety. Maybe that's therapy, maybe that's medication. Maybe this is a thyroid issue. Maybe this is menopause and hormone changes, and there's a lot of that going on. So it certainly sounds like this person has identified a major issue for herself and deserves to have that
Some things I'd add is just put the phone down. Just see if you can limit or decrease the amount of phone time you have in a day, and set a time where you're not going to look at it anymore. taking some time for some deep breathing and reflection or meditation. Exercise, stretching, yoga, whatever works for you. But even just a few seconds, 15 seconds for some deep breathing can be huge. And I love doing that, practicing that with my patients, because it helps me feel better too in that moment. And just taking a few seconds to breathe in through your nose and out through your mouth. And if you can just do that a few times a day, that can really, really help. So a couple other thoughts there.
Yes, wonderful. Well, another viewer says they've been getting frequent headaches and vision seems a bit blurry. They spend a lot of time working on their computer. How do they help with that since they work on their computer all day? I would say check with your eye doctor first off and see, is there eye strain? And it's always good if you're focusing up on a computer, at least once or twice an hour to look somewhere in the distance, look away, rather than, because that focal length, if your eyes are always focusing near with that screen with that flicker refresh rate, that can be hard and cause that eye strain. So again, looking in the distance. Remember, as a med student, studying for hours and reading, I'm like, I'll have to look up here and look at the horizon to let those muscles in the eye of the iris that have to constrict down when you're reading, just relax a little bit, and because that definitely can cause some vision issues. But I would say start with your eye doctor and get that checked out.
Yeah.
Yep.
All right.
You could just be the host and the answer.
There we go.
We'll just nod in
exactly.
agreement.
We'll just nod and agree.
Well, I don't think I'm going to do the next 20 questions by myself, but
I don't know. I think that would work. I enjoy hearing you talk. Almost as much as I enjoy hearing myself talk.
it's like we're old friends. All right. Well, my stomach has been upset, not mine, the viewers, and I get a lot of gas lately, especially in the morning when I wake up. What could be causing this? It's not always the same food, and I do not eat too late at night before bed. What could be ailing this poor person?
Again, I have more questions. I mean, I think a lot of folks, if they come in, especially if they're talking about gas like flatulence, which
Like
is,
farting.
is the assumption that I'm making here, I ask them about bowel habits because constipation definitely can increase that. The longer that food material stays in your gut, the longer the bacteria have to make gas, and so you may have more of that. Maybe there's been sort of a change in the gut flora, and certainly with aging, we see just motility change. So I have questions about that. Usually, if really gas is the main concern, I would consider that kind of a benign thing, but there's definitely things to trial and error to see if you can make that person more comfortable and feel like they're moving things along better too. So.
It sounds like they've paid attention some what they eat, but I don't, have they made a conscious effort to decrease dairy, or sometimes we become a little more lactose intolerant with time, or alcohol, or wheat, or whatever. There's different things you can try.
More fiber.
More fiber, absolutely.
Less fiber, yes.
Yeah. FODMAP diet.
FODMAP diet, yes.
And what have we done to this person?
Right.
Medicines can be a culprit too.
Absolutely.
Definitely.
Yes.
Yeah.
All right. Next question is a gentleman says they're in their 50s. They get dizzy when they stand up too quickly. Blood pressure seems fine, but when they go to the doctor, it's always higher than at home. What could be causing this? Well, I think that's two issues. Blood pressure higher at the doctor's, not unusual. White coat hypertension is a pretty famous and notorious thing that happens to people.
Dehydration, medications, if their blood pressure is high at the doctor's, do we have them on blood pressure medicines? Are they on a fluid pill for their swelling? How much caffeine are they drinking? There's a lot of things that become more of a problem for people as we get older. Orthostatic hypotension.
Oh, please don't say 50s older.
Older. Hey, older.
As we get older, our vessels lose some of their compliance, and you can have higher highs and lower lows, and you can get lightheaded more easily when you stand, and the different mechanisms that control that don't work quite as well over time, and so this person's only in their 50s.
But they're not in their 30s anymore.
Oh, don't remind us.
Compression socks could be something, certainly
That
pushing
might be
fluids. And
Check blood sugar.
Yeah.
Check blood sugar.
Anemia can do this, even regardless of blood pressure. So yeah, it's worth a talk. You know, if that person comes into my office and I'm reviewing medicines, because if they're on blood pressure medicine, we might be the cause of that. We might check blood pressures as you stand up and see, does your blood pressure indeed drop, just to be kind of more diagnostic about it. But yeah, I think the worry is that sometime to the extreme that can actually cause a fainting spell, right? If your blood pressure drops too low and you get dizzy when you stand up, we don't really want that to happen. So I would talk to your doctor about it.
And remember that over-the-counter things can cause these issues too, and supplements. And I feel like sometimes there's an increase in supplement use, and some things can be beneficial, but all of things are compounds and they can have their own set of side effects too. So something to consider.
Yeah, just because it's natural doesn't mean it can't hurt you.
There you go. All right, another viewer says the left side of their foot hurts when they get up every morning, and their feet are stiff when they first start walking. They're fine after a few minutes. Sometimes the left side hurts on and off during the day, especially if they stretch it. What could be causing this hurt and stiffness in the morning?
Morning stiffness is kind of classic for arthritis and osteoarthritis, that sometimes you can work it out. Now I understand this is sometimes worse in the day, and was there numbness in there too?
Let's see.
Anyway.
It just said pain. So I was also thinking plantar fasciitis. That's a very classic, hurts first when you wake up, and then the more you walk, you kind of loosen it up. Because that plantar fascia is that tendon that goes from your heel kind of to the base of the toes, and at night, you know, your foot's kind of bent down, and that can tighten up, and then when you stretch and you step down on that foot, you stretch it out, and then it hurts. So that can definitely cause.
Yeah, there's a lot of things that can cause foot pain, but that's probably the number one common
With this
thing we
kind of
see.
thing.
Yeah,
And especially with the stiffness just for a few minutes, you wouldn't think of something like rheumatoid arthritis would last a lot longer than that. So sounds like the first thing I'd do if this were me would do some stretching.
Roll your foot on a tennis ball. That's another good exercise for plantar fasciitis. Or the frozen juice containers, and then you ice it and stretch it as you're rolling it. Good.
Yeah.
Well, medical students need hands-on experience to prepare them for success. They use medical mannequins in simulation labs to help the students engage in clinical scenarios. They learn essential procedures and develop critical humanistic skills while applying evidence-based practices prior to caring for real patients. Prairie Doc spoke with Kimberly Patterson, director of the Des Moines University Medicine and Health Sciences Simulation Center, about their simulation lab.
So we create these simulated environments that allow our students to practice their skills, teamwork, communication, whatever they're learning in their class, they can come and practice in our lab with, safe space and with simulated patients, whether that is a human who is portraying a patient and then providing feedback from the patient's perspective, or a full body computerized patient, which can breathe and have heart sounds and pulses.
Patterson says there are multiple simulation labs.
The task training lab is when the students are focused on learning a very specific task or skill. So that might be something like how to insert an IV. And when they're first learning, we just give them a piece of a fake arm with veins and simulated blood and the equipment they need, so they can just focus on getting the steps and, keeping their site clean. And, they may later utilize those skills in the context of a bigger simulation, but we want to make sure that they've learned those skills. Intubation, putting a tube down somebody's throat to breathe, or inserting a chest tube.
She says the simulation labs are important for the students.
For a long time when we were training healthcare providers, unfortunately, a lot of things were done for the first time with real patients. And that's just not what our public expects, nor should they have happen, right? And so this is an opportunity for our students to practice everything from the basics, how to get a history and ask questions, to low frequency, high stakes scenarios, like a patient comes in from a motor vehicle accident and has a very, very traumatic injuries. We can simulate all of those. And so the students get the opportunity to practice it. And it's so much more interactive and increases their learning so much more than just learning it from a textbook.
right, well, that was my alma mater for medical school, and I was just amazed when I went back to see how much things have progressed since that time. But we'll get right back to questions since we have many more and not that much time. So a 55-year-old woman from Sioux Falls stated that they noticed a new mole on their back. How can you tell if it's benign or something to be worried about, like skin cancer?
Go see your PCP. I tell people all the time, they might come in and say, I had this new mole, and sometimes I look at it and say, oh, this is a benign type of mole. Often like a seborrheic keratosis would be the most common kind. And they might say, gosh, I'm sorry for wasting your time for something like that. And how are you supposed to know? That's what we're here for. Come see us.
Come see us.
Exactly. So, and also the ABCDEs of melanoma. So asymmetry, if it's irregular shape, B, border, if it's kind of an indistinct border, C, color, more than one color in it, D, diameter, if it's bigger than a pencil eraser, and E, expanding. So if you're saying it's a new one, that kind of counts as the expanding. So I would get it checked out. So.
And they might say, oh, I think I want to wait till dermatology, but if that's several months out, it's not worth waiting.
Not very practical.
No.
Yep.
So, all right, next question. I'm in my 40s, and during my period each month, I get bad tension headaches. How do I keep these from coming each month, and how do I help them go away when I get them? Sometimes Tylenol doesn't help. Oh, menstrual migraines.
That was going to be my thought. Those hormonally associated headaches are very often migraines, and that is something you should go talk to your doctor about. It is absolutely miserable, and it can really dominate your life.
Yeah, and there are medications you can do to prophylax to try to prevent the headache from coming on in the first place. And sometimes you just do those if your periods are pretty regular, although perimenopause are not always. But sometimes you can use them kind of in the days leading up to help minimize those migraines.
And there are things we can do even to just help the headache go away more efficiently than the over-the-counter things.
Exactly. All right. Next question. My child has had a cough since going back to school. When should I bring him in? No fever. It's not there all the time. Could it be the sign of a more serious lung condition? I have more questions.
This sounds like my kids, and my kids have some mild asthma, and I would say that would be a very common problem. I don't even see kids. I just know this from my own kids, but asthma is fairly common in children and would cause kind of this chronic or intermittent cough that's dry. But,
yeah, I mean, in this case, school hasn't been going on that long yet, so it could still be a viral thing and just kind of some lingering inflammation in the lungs still causing a cough, and it might just still go away. But certainly, coughing at night is more classic for asthma, or coughing more with exercise or with activities, and sometimes, you have exercise-induced asthma, and an inhaler can be helpful with that. And so getting that evaluated, if, certainly if it persists beyond a month, would be reasonable, or if they're having trouble breathing or any concerning signs. But allergies are certainly a factor too.
It's that time of year.
This time of year, and then now we're going to be combining, and it's been a more moist summer than other years, and it's different for other people. And allergies can creep up over time, even though you didn't used to have allergy problems, you might. And so an allergy medicine over the counter or a steroid nasal spray can be helpful. Worth trying that if it doesn't seem to be getting any better.
And I'd say if they seem well otherwise, you can wait a little while for it, especially if there's not a family history of asthma or allergy issues.
They're not waking up at night and they're not that bothered by it.
Not keeping them from doing what they want to do. It's no harm in waiting for a little while, a month or so.
All right, Deb, here's your Stump the Prairie Doc question.
Okay.
You were waiting for it. Here it is.
If it stumps Kelly, then we're in trouble.
Okay. Would GLP-1 meds ever be a safe treatment for Hashimoto's and hypothyroidism to reduce the fatigue, inflammation, and antibodies, even if not considered overweight? Are these meds safe long-term? That is a very thoughtful question.
I mean, I think that's more than one question, but it is a thoughtful question. I would say, I don't think you're ever going to be able to avoid replacing thyroid sort of supplementation. I don't think this is going to substitute for the levothyroxine or anything like that. And I'm not aware of any research in GLP-1s in autoimmune disease, which is maybe more what the question is asking about. I'm not aware of any promising research. There is promising research in other aspects of health, and maybe it's out there, but I don't know if I'd bank on it. Yeah.
You know, where that benefit is seen, where it affects different diseases, if it's helping to fight or help with obesity, and obesity is raising the risk of some other conditions. But I'm not sure about those conditions in particular.
I think there's also some really promising, not necessarily research, but observations, and I think that that's a really important thing. A lot of things in medicine, think about using Zyban or Wellbutrin for smoking cessation. You know, you're studying something for something else, and then you make the observation that, oh my gosh, look at it, it's helping with this. And then you have to look at that. Was that real, or was that just a statistical or association fluke? Why is that? And I am not aware of anything suggesting that the GLP-1s have an effect on the autoimmune or the immune system that way. There is some data about, or some observation, improving addiction, other addiction behaviors.
That's very interesting. I think we're going to get more information on that in the next 5 years.
I think so too. I think that's going to be a really, really exciting area of research and investigation. But the fatigue and the actual thyroid function, I don't think we're going to see that. Just thinking about how those medicines work.
I don't have any reason to suspect that either.
Long-term safety, you know, the GLP agents they're relatively new agents, but they're not brand new agents, and certainly, you know, we're seeing an explosion in their use, and anytime you use something in large numbers, you get more data about the safety and the incidence of rare things than when you're trickling in a few at a time. So
yes. So another viewer, 74-year-old male, is wondering what affects urine flow. I'm assuming at night time would be the big.
Andrew. We're going to give you
Going back to the prostate.
Yes.
What is the prostate? It's this little gland sitting above the bladder, or below the bladder there, and the urethra, or where the urine is exiting the bladder, is going through that. And so as that gland is enlarging, it might be pinching that urethra some and making it harder to empty the bladder completely. And you say, well, the problem isn't emptying the bladder, I have to go all the time. Well, you're going, but is it as strong? Are you emptying completely? And so then that's where that frequency comes in. Maybe dribbling, maybe harder to get going, or you go and stop, or go more frequently. And so there's some medications that can help with that and help shrink or relax the prostate. Sometimes a person goes for surgery, a TURP, transurethral resection of the prostate, and then that can help a person pee more effectively and urinate more effectively.
terms are fine.
But
speak English.
But yeah, it is a common issue, and it's not one to ignore, because if you ignore it enough, you can have more urinary tract infections, and that happens, or even kidney damage, or something even more serious. So
you can overdistend your bladder enough, because it doesn't actually get enough of the urine out, that your bladder muscle gives up.
Right.
So.
All right. Next question. What do the doctors think of the dermal weight loss patches? Are they safe? I don't know.
I don't think that there is any patch medication that is FDA approved that has been through testing, and not that there's not very things that are going to be shown to be useful that are not shown to be useful yet. And I'm sure that the drug companies are doing very aggressive research in new and different treatment options that avoid shots, but this is something I would very, very strongly encourage people to do a lot of, not just do your own research, but actually look for quality information and not testimonials.
All right. Well, how reliable is the new blood test to detect colon cancer?
Not very.
Okay. Next question.
So that test, Shield test, it might be, I can't remember the exact numbers for detecting colon cancer. That might be decent, but not near as good as Cologuard, which is in the upper 90s, and not near as good as the gold standard colonoscopy. And let's remember that the benefit of colonoscopy for colon cancer screening is we can detect those polyps and take them out before they grow into cancer, and thus you have the preventative care aspect of it. The Cologuard only detects about 40 to something % of advanced polyps, or polyps that have only grown centimeter or more. And so there's a lot of polyps getting missed even with that one. And I've detected colon cancers in people that had had a negative Cologuard already in my career, and when it's only been out for a few years. So it's, unfortunately, it's a great way to get colon cancer screening for people that can't do colonoscopy or don't want to do colonoscopy. And colonoscopy is not without risks either, but you miss out on the preventative aspect. But I can certainly advocate for Cologuard if you don't want to do colonoscopy and you want to do colon cancer screening. I'm sorry, that obviously is something I'm passionate about. But I can't advocate for the blood test, which a lot of insurance companies won't either and won't even cover it for people yet.
All right, we have 8 questions in 4 minutes.
All right.
So 30 seconds.
Do our best.
Are the COVID and measles viruses still a concern?
Yes.
Okay, next question. What are some things that can cause wheezing upon exhalation? Should I see a doctor if I'm coughing up phlegm or wheezing?
Yes.
Yes. Okay.
COPD and asthma.
Yeah. Sorry. All right, we can
do
elaborate a little bit.
Yeah, there's a lot of things. If you're coughing and wheezing, you should go in, especially if this is not, oh gee, I had a sore throat, a runny nose, I've been sick, if it's more chronic, or if you're short of breath, if you're feeling poorly and not just, I've got a cold.
All right, 2 viewers both asked questions about plantar fasciitis. One says they've done PT and cortisone shots. What are the suggestions to get rid of it? The other one says, what are the treatments? Well, there are 2, PT, cortisone shots.
We talked about the conservative
stretching
and rolling and icing already.
Yep.
We did talk about night splint that you can put on that sock that puts your foot up, and thus overnight it's not healing like this, but it's healing already stretched, and that can be helpful.
And that was the thing that made the difference for me. I did everything except the cortisone shot because that sounded very uncomfortable. I did PT for a long time, and it was the sock that made the big difference for me.
All right. And talking to a podiatrist, sometimes getting custom orthotics can also help. So there's other options. All right. Viewers called concerned with persistent back and shoulder pain when lifting the arm. So what could be causing that?
I would say rotator cuff tendon problems are the most common thing that would cause that problem with overhead movement. But I mean, that's not the only thing, but certainly that'd be the most common shoulder. And you don't have to have a traumatic injury. It can be just overuse that does that. So.
Or getting older.
Yeah.
And physical therapy can really be helpful for that.
For sure.
They're good at helping with that.
Yeah. Adhesive capsulitis, frozen shoulder, that sort of thing could also be causing that as an issue. So. Another viewer says they are a stomach sleeper and cannot keep their nose device on at night. What is your opinion on the new surgical throat device? So I think they're talking about
Inspire.
The Inspire, and that their CPAP is not fitting.
I think talk to whoever's managing your CPAP, see if there's any creative ways. Obviously, CPAP is still the gold standard, but the hypoglossal nerve stimulator is a good alternative to people who truly can't use it. You have to meet certain criteria. It's not for everybody. There's some things that depend on your sleep apnea and your anatomy and your weight and that kind of thing too.
We're doing a whole show on sleep apnea later this year too.
All right.
There we go. We can talk about it more then. But I've had a few patients that have had it done and have been really impressed with it. So. It's my N of like 3, which is not a statistical sample, but did seem to make a difference. Another viewer says, how do you know if you have a pinched nerve? I thought it was my hip and had x-rays and a cortisone shot, but that didn't help. Could it be a pinched nerve?
Sure.
Yes, there's a lot of nerves that kind of run through in the same area that cause hip pain. So it might be the sciatic, it might be the piriformis, it might be the back. There's a lot of different things, and a lot of things in that area can look like other things in that area, just like a lot of places in medicine. So that would be worth going in and talking with your doctor, talking with your orthopod, talking with physical medicine and rehabilitation doctor. Sometimes it takes us some thinking and investigating to figure out where pain is coming from. It can be very tricky.
All right. Another viewer says, what is low hemoglobin? That is a term that gets thrown around a lot. I've got low hemoglobin. What is it?
Anemia.
Anemia. There we go.
Often called low iron. And I think that is probably the term that people are a little more familiar with. It means that you're anemic. Iron is not the only thing that causes it, but that is probably the term most people are more familiar with.
We go in and get some blood tests. We might need to do a stool and a urine test, look into causes or other tests.
It's not normal.
Not normal, no. And hemoglobin, that's just the name of the
substance in the red blood cells.
The red blood cells that helps carry oxygen. So it matters, but yeah, we should always ask why.
Yep. All right, we have 2 minutes left, and here's the last question, which I thought was very sweet. How is the life of a doctor? Prairie Docs, how is your life? I'm very that was very thoughtful. Thank you for asking.
Very nice.
Thank you for asking about us.
I think this is a particularly challenging time to be in medicine. I think that we're all very worried about our patients and the people that are going to lose access with some of the changes in healthcare. A lot of the smaller hospitals particularly, I think their existence is very dependent on a lot of those payment sources, the government assistance that is endangered, and I think that worries us all. And measles is out there, COVID is out there.
That being said, we love being your doctors.
Yes, we do.
The
we worry about you.
The day-to-day of being a doctor is really fun and rewarding and lovely. It's some of these overarching things that are stressful in the world.
We have the benefit of being in our roles for quite a while, and so we've got patients that we've seen for a decade or more, and that really adds more meaning, and that we've helped them through this and we've helped them through that, and learned this with this patient and learned that with that patient, and give or take, and there's some great benefit to that. So I encourage everyone to pursue a primary care doctor and to have someone that you can bounce things off, especially in this age of mistrust and misinformation that can become frustrating for all of us as well, that we didn't used to have to deal with. If you can get that relationship and with your doctor, that can really be helpful.
Well, I have nothing to add to that, but I will say for the medical community, we were saddened this week to hear about the passing of Dr. Jim McGran. And he was the founder of Dakota Dermatology in Sioux Falls. He was a frequent guest on Prairie Doc, very good friend of the show. So we do want to give our condolences to his family and friends as we heard of his passing. So the medical community was definitely affected by that this week with that. So our winner here for the call-in was Catherine. A book will be sent to you shortly, so we'll be back after this.
Hi, my name is Joni Holm, and I serve on the Healing Words Foundation board, the nonprofit that runs the Prairie Doc programming. Our mission is to enhance health and diminish suffering by communicating useful science-based information respectfully and compassionately. Your donation supporting Prairie Doc programming makes an extraordinary difference. Gifts of any size enhance its impact in our state and beyond. Thank you for your generosity.
Don't miss out on the latest insights into health and wellness. Be sure to pick up a copy of your local newspaper or explore the Prairie Doc Perspective online, a weekly column dedicated to providing valuable information on health and medical topics. Access all previously published columns and stay informed by visiting www.prairiedoc.org.
As we finish up this evening's discussion, I want to thank our Prairie Docs, Dr. Ellsworth, Evans, and Johnston for sharing their expertise and time with our viewers this evening. And thank you to all our viewers for tuning in tonight. We appreciate your viewership and support of our mission as we continue to provide science-based health education. Don't forget to follow us on Facebook, Instagram, YouTube, and TikTok for more information and updates. If you missed submitting a question tonight, send it to ask@prairiedoc.org to be answered in our weekly radio program, Prairie Doc Radio, Sundays at 6 a.m. and 1 p.m. on SDPB Radio or streaming online. Thank you for joining us here tonight. And as our former founder would say, stay healthy out there, people.
Autism spectrum disorder necessitates a tailored approach to care, recognizing each individual's unique strengths and challenges. Insights and advances in care for autism. Next time on Call with the Prairie Doc. Major funding for On Call with the Prairie Doc has been provided by
At Avera, our nationally recognized health system will be right here with you with care and coverage. Hello possibility. Hello healthy. Hello life. Avera, moving health forward.
Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information. And with the ongoing support of these individuals and institutions, Brookings Health System, South Dakota Academy of Family Physicians, Sanford Health, Avera Medical Group Brookings, Avera Heart Hospital, First Bank and Trust, Dakota Allergy and Asthma, Monument Health,